Do you think having sex once is enough to get you pregnant?
There is an intercourse. 100 million sperm are released in the vagina. Out of this 100 million, guess how many will go up to the egg?
One.
It's not one. If a person is dipping himself in hot tub in a water temperature that is 40 degrees Celsius 3 times a week, he is likely to have zero sperm count.
Now, about pills and condoms, is there any other safety measures that you recommend for them?
They even use saliva, and saliva also is a sperm killer. Most of them don't know that. There was a man in the US. He actually removed his pants and he was basically testing the efficiency.
Okay.
And ultimately, you want to have a baby who's 9 months old. You don't want a pregnancy positive. You want the pregnancy to go on healthy.
Hi, this is Skinny. In conversation today, we are with Dr. Shashant, surgeon and fertility specialist. Today, we're going to talk about IVF, fertility concerns, and sexual awareness. Do you think having sex once is enough to get you pregnant?
Yes, a lot of the patients, they ask me, Doctor, we have just rubbed outside, or we've just been involved in a single incident. What are our chances? Do we really need to take some emergency contraception? A single incident of sexual intercourse, it can give a pregnancy if the woman is in the fertile days.
Okay.
So why that happens even with the tiniest quantity of sperm is the sperm survives in the uterus, in the fallopian tubes, for up to 5 days. So in that 5 days, if the egg releases, it is able to fertilize it, and then the pregnancy forms, and then 2 weeks later she misses a period, and there you have the 2 lines. The chances of that happening, if it's a full release inside the vagina, the chances are around 20 to 25% in that cycle.
Okay.
But if it's an external release or it's just some contaminated contact, then the chances are less than 1%.
Okay. Oh, less than 1%.
Yes.
That's good. Now we live in a generation where Gen Z is learning more about sex from social media than from schools. How important sex education is for the younger generation?
There are a lot of fertility myths because of which the younger generation is not knowing what to believe. Most of the times, these are marketing gimmicks. They can be anything from testosterone boosters or something that helps them improve the performance, or they're watching a lot of this adult content, which is not really teaching them about how things work. They have sometimes unrealistic expectations about the performance in bed when they see a lot of this content. Not just that, they get desensitized because they get so overstimulated by all of this. They're more prone for stress, anxiety.
Now, I also see that the hookup culture is rising here in the younger generation. So do you think it's safe for the younger generation, or what safety measures should they take in regards with their sexual health?
There is a risk of infection. So it's very important that they know when to test themselves. I always recommend that they use barrier contraceptive like a condom, so which protects against pregnancy and infection, not just pregnancy. So if you're using something like pills or injections, it doesn't guard them against that. Secondly, when there are multiple sexual partners that are involved, the name of the vaccine is human papilloma viral vaccine.
The HPV?
HPV, yes. And now there are 9 different strains of viruses which it protects against. And there is also a hepatitis B vaccine. Not just that, they can get themselves swabbed near the doctor, and the earlier you do it, the better, because a lot of these infections could result in permanent scarring, permanent damage to the delicate reproductive system. This awareness is important.
Now, I want to ask you, this is the health aspect. Do you think this hookup culture is affecting the younger generation both emotionally and psychologically as well?
Younger crowd right now, they're all in for a work-life balance. They focus on gender equality. What they're not yet focusing on is their fertility preservation. A lot of them, they have organic food, they balance their diet, and they're very calorie conscious, health conscious. However, fertility is not always equal to health. So you may look perfectly fine, but that doesn't mean that your sperm has or your egg has perfect DNA or genetics. Therefore, what's important is age. No matter how healthy you are, it's the race against time that your fertility is going through. I would definitely not recommend them to delay their fertility planning till 35 years of age, because they always think that's for 30s.
Yeah.
Right now, it's about career.
Correct.
So they're always in a sort of a race to get to something. And by the time that they realize that, okay, now it's time to have a kid, the biological clock, it's already a toll on them.
Okay. Now, about pills and condoms, is there any other safety measures that you recommend for them? Since I think most of them don't have the knowledge about. Is there anything else that you want to add that they can take in regards to sexual protective measures?
In these two options, I would recommend that condom is the more safer option here, because there is a direct barrier which doesn't just protect against pregnancy, it protects you against infections. There are many methods, like you can take an injection, or a lot of them, they prefer to use something called the I pill, which is the morning after pill.
After pill.
So this pill is effective ideally when it's taken within 24 hours.
Okay.
It may have a beneficial effect when it's taken within 3 days. How it works is, it doesn't allow the fertilized egg to implant into the uterus. It doesn't stick to the uterus. If the egg has not been released, it doesn't allow the egg to release itself. So that's where it prevents against the pregnancy. But the issue with using this pill is, they can have a delayed period. They get confused. Is it because
I
of...
also heard they affect the health of the women, like hormonal changes or else, like they put on weight or something like that. Is that true?
So the morning after pill, it has a high dose of a progesterone. And progesterone side effect is usually bloating, water retention, or pimples, or weight gain. If this is repeatedly used, rather than using a routine contraceptive tablet, which is on a fixed low dose, it has the potential to throw your period cycle out of rhythm, out of predictability.
Okay.
Yes, so it's not recommended.
So is it safe or no? What do you recommend?
So I would say that it is to be used only in an emergency, in an absolute emergency, where a condom has torn and there is a risk of pregnancy. Even with a single incident of sperm leaking inside the vagina, there is a chance of pregnancy.
Okay. So when you think is advisable to take the HPV vaccine, how long should the duration be to conduct themselves with these health checkups?
So with HPV vaccine, anyone less than the age of 26 years is the ideal candidate to take this vaccine. It's best to be taken before the onset of the first sexual activity. So HPV, the virus, it causes a certain degree of inflammation, infection, which could eventually even lead to warts or cancers.
Oh, okay.
This is the reason that the vaccine is to be taken 3 doses, 0, 1 month, and then 3 months. These are the 3 doses.
Okay.
And after a while, the antibody, the defense against the virus is built up in your body.
Okay.
And it helps to guard against at least HPV. There are some other bacteria that cannot be prevented with this vaccine.
Now we also see that there are a lot of lubes, sexual related products that are being sold online on different apps. So do you think they affect the sexual health of people? How does it affect?
So for couples who are planning for pregnancy, I would recommend them not to use lube that has a high amount of glycerin or some sort of flavoring agent in that, or if it's having these effects that they write like tingling. And these kind of things are more prone for damaging the sperm. They are sperm killers. Some of them, they are using gels that are not prescribed by the doctors, or they use even coconut oil, Vaseline. I mean, they even use saliva, and saliva also is a sperm killer. Most of them don't know that.
Okay.
There are special lubricants and gels which can be used if you are planning for a pregnancy. And there are some different type of gels which are actually sperm killers. They are kind of contraceptives. They are to be used with a condom.
Okay.
So it gives that additional protection.
So do you think there are any medicated lubes that are safe to use instead of, being the sperm killer?
So it's not a medicated lube, but it's rather a pH balanced lube.
Okay.
It's called pre-seed.
Okay.
And it actually helps the sperm swim closer and easier into the cervix.
Are they available over the counter?
You can order them online also.
Okay. So why is this rapid decrease in male fertility as well?
It's a combination of factors that is happening. One is people are planning their pregnancies really late because it's become a race. It's become stress of education. A lot of the people are not able to plan the finances, burden of responsibilities
Absolutely.
in their 20s.
Yeah.
The other reason for the falling fertility is a rise in the substance abuse.
Yeah.
A lot of the people, they are also riding vehicles for a very long time. Particularly, there are certain types of seats which are pushing the testis in close proximity to the body. When there is an overheating, testis is such a heat-sensitive organ that the sperm production starts to come down, the quality changes. How fast does that happen? I'll tell you. So if a person is dipping himself in hot tub for 20 minutes, 3 times a week, in a water temperature that is 40 degrees Celsius, he is likely to have zero sperm count at the end of 1 year.
Oh,
Can you imagine how much heat is important?
correct.
So that's why we advise them to wear loose linen or cotton trousers, not to be on a motorcycle for extended periods, not to keep a laptop onto the lap or any kind of electronic devices close to the testes. How this was actually proven was there was a man in the US. He actually removed his pants and he was basically testing
What?
the efficiency.
Okay.
He was testing the efficiency of the scrotum, which is the muscle and the skin, and how they are reacting in response to the
Temperature.
yes.
Okay.
So when it was getting cold, the muscle contracts and the testis immediately comes close to the body. And when it's kind of hot, it again pushes it down. It's kind of like a car's radiator.
Okay.
It regulates its temperature really well, and it has to be at a temperature of 34 degrees. That is 2 degrees less than the body temperature.
So are you suggesting cold showers are better for sperm boosting? Do you think?
I wouldn't say that you need to go for an ice bath in order to boost your sperms. Because even when you go to any extremes, there are some circulatory chains.
Okay.
So just kind of body temperature to mildly lukewarm water and a short exposure to that kind of warmness,
Okay.
that would improve the sperm quality tremendously.
Quickly, doctor, can you just give me 5 sperm killers? Anything that's rapidly decreasing the sperm count in males?
So first is smoking alcohol. These are poisons. They enter into the testis. Normally the testis is a well protected structure. It's not easy for even bacteria or viruses to get inside.
Okay.
But alcohol, it gets through, it damages the testis from inside, and it reduces your sperm count and also your sexual performance.
Okay.
Second is obesity, increasing weight, changing diet. These trends are going on across the country. Obesity can kill the sperms just by heat as well as predisposition for diabetes.
Okay.
And there is a hormonal imbalance that happens. Third is medical problems. Diabetes is high blood sugar. It goes undetected in many. India is now becoming the diabetes capital of the world.
Yeah.
The high blood sugar, it acts as a poison. It kills the sperm or it spoils the quality. There are a lot of men who are coming to consult me who are having sexual disturbances purely because the diabetes is damaging their nerves.
Okay.
The earlier you catch it, the better for the sperm and the better for the sexual performance.
Okay.
So the fourth is pollutants, chemicals. The fifth is getting exposed to heat. Anyone who's working in a kitchen or working in a mine where the local temperature is too high. So most of the time the patient think I'm talking about body heat. Body heat is already automatically regulated by the testis. It's external heat. If you're sitting in a sauna or a hot tub, these kind of external heat is what kills the sperm.
Quickly now, can you just give me 5 superfoods that are going to help the males boost their fertility?
So the 5 superfoods are dry fruits such as walnut and almonds.
Okay.
Second are pumpkin seeds. Third is banana. Fourth is pomegranate. And fifth are berry fruits like kiwi, mulberry, strawberries. They're all rich in antioxidants. They are rich in vitamins which are essential for the sperms.
Do you think someone with 0 sperm count can get a woman pregnant?
So someone with 0 sperm count can get a pregnancy by a method called IVF ICSI. We have to find out the reason for the 0 sperm count. Most of these men can still get their sperm which are hiding in the testis. So we have to retrieve them, and using these sperms, we inject them into the egg of the partner, and then we create the baby, and then we have to put it back. Because with a 0 count, it's not possible to have a natural pregnancy. So you need to create the pregnancy. We have had so many patients who had a 0 sperm count and they took home a healthy and a very cute baby.
That's very good.
Yeah.
Do you want to suggest anything other than lifestyle and diet to increase the sperm count?
A lot of my patients, they first try to understand why their sperm count is low. In 50% of the times, we find a cause through a proper history taking, and then we examine the patient with some scans or blood tests. We get to know what is really going on with that patient. So after a thorough testing, we try to give conservative treatment. That is, we try to first figure out what it is that they're doing from morning after they wake up till night when they sleep. How much is their sleep? So ideally, there should be 7.5 to 8 hours of sleep. How much water are they drinking? Is there any dark color in the urine? Is there a chance of infection? Or is there any sexual issues? Are they having any mental stress? We have to get to the bottom of each individual cause and we correct that.
Okay.
After that comes their diet. So everyone thinks that, okay, there's some magic diet or there's some magic supplement that, I have to take this for 3 months, 6 months. I have to bring some changes in my life. I've been very bad up till now. I'll do something and then maybe my sperm count will increase.
Okay.
So the issue with that is if you're taking an unhealthy diet or you're living an unhealthy lifestyle, the sperm count will drop. But if you have been having a healthy life, it's not necessarily that your sperm count will be always better.
Okay.
So that's the paradox here. That's the confusing aspect.
Now, since we're already talking about physical health, let's talk about mental health. Do you think stress and other anxiety and other issues related to mental health affect your sexual health?
Mental health is as important as physical health. There is a stress hormone called cortisol.
Okay.
And cortisol level, when it goes high, because you're constantly worried, you're overthinking, you're stressed, this cortisol hormone, it pushes down the levels of the other hormone, which is the testosterone hormone. And it also has an effect on the sperm quality. As a result, the testosterone is low, the sexual desire is low, the body goes into a survival mode. When you're in a survival mode, your body doesn't think that, okay, let's create a baby, let's create a life. It's just like you plant some seeds in the soil and the weather is bad. So the plant won't grow. When you have so much of stress going on in your life, you have irregular periods, you put on weight, you have acne, you have pigmentation, and you have hormonal disturbances. A lot of this could even lead to heart disease, could lead to diabetes, depending on the genetic predisposition. And fertility is just one of those.
But can you talk about it in male aspect as well?
So when a man feels anxious, the level of testosterone hormone goes down. A lot of the men are coming with financial stress, or students are going through some examination stress. They are having this overthinking and anxiety issues.
Correct.
Because of which they are having hormonal imbalances and they are having a poor quality of sperm that's coming out, and they are having sexual disturbances. You won't believe the number of people who are having erectile problems, ejaculatory disturbances, and they are all the time conscious. Did this happen because I used to masturbate very frequently when I was in my college? They have all sorts of doubts cropping up because maybe I was bad back then. That's why I'm suffering right now, is what they think. So masturbation as such doesn't have an impact on the sperm quality for a permanent level.
Okay.
It has just a temporary effect.
Okay.
And again, the sperm count, quality, everything replenishes. But the same thing, you're consuming too much of adult content. Your mind is overstimulated. Sometimes your expectations become unrealistic. And then nothing pleasures you, after that. When they reach that level, they get stressed because of that.
Okay.
They have anxiety issues which are causing erectile dysfunction. They're not able to achieve the penetration. They're not able to have a successful release of the sperm. Everyone wants a tablet for everything. If they have an ejaculation, they come to me, doctor, give me a pill so that I can ejaculate. Ejaculation is a psychological and a nervous coordination.
Correct.
Your mind has to be relaxed. You have to feel comfortable with your partner. There should be a connect. And things should be taken slowly. There should be attraction. I mean, if he's constantly thinking, what would my wife think?
Peer pressure?
Yeah, I mean, peer pressure is one of the reasons. Or, if the wife has been very stern about certain things, he is in a sort of on-demand performance anxiety. He will not be able to have even a proper erection.
So do you think there is any medications that will, make your sex life better?
There are some tablets which we can prescribe, which are going to boost the desire, or rather the testosterone levels. But that has to be done on a more natural level. We can't prescribe steroids, which is testosterone as a steroid. We can't directly prescribe it because if we give testosterone, brain thinks that there's plenty of testosterone, I need to stop producing sperm.
Correct.
And it lands up with a zero sperm count if it's been taken on a continuous basis. A lot of the people who go to the gym, they take these supplements, they don't really know how it affects their body. Anabolic steroids, they think they want to bulk up. When they have done a study on most of these men, they found that their sperm count is actually zero. The testicular size are tiny, and some of the times it is not even recoverable. It cannot be fixed.
Okay.
Depending on how long you took it or what was the dose of steroid that you took.
Okay.
So for fixing of the sexual disorders, everyone wants a pill. So for erectile dysfunction, first I counsel them about behavioral therapy. We go with something called Kegel's exercises, which are pelvic floor exercises.
Okay.
And in general, the cardio, good diet. What they need to eat, they have to take spinach, green leafy vegetables. If they're non-vegetarians, they can have eggs and fish and lean meat, proteins, and a lot of berry fruits. They are very rich in vitamins and antioxidants. Definitely be certified by the doctor when you're using some supplements.
Okay.
Don't go on the web trying to search for something which is having some unknown chemical, because a lot of those are also having caffeine or just something that gives you a temporary psychological boost, and probably you feel energetic after that.
Yeah.
But it's not really doing anything at the core level to the sperm or to the sexual performance.
Do you think low testosterone is also equal to low sperm count? Are they both the same?
So if the testosterone is low, we have to first find out what is the cause for that. So commonly we find that it's because of obesity, junk food habits. There's a lot of fat in the body.
Okay.
And fat always takes the testosterone and converts it into estrogen. That's abnormal. Second is because of poor sleep. This is happening a lot. There's a lot of people in night shifts. So the rhythm is always changing and the body doesn't get time to rest and repair.
Okay.
And that's why the testosterone level can drop, because of all of the stress. Few of the reasons can be related to the testis itself. So testis is not producing enough testosterone. And there are innumerable causes for that. There can be genetic causes. There can be infection. He might have had a cricket injury or sports injury in childhood, because of which his blood supply was changed. Some of the men, they are having something called cryptorchidism, which is basically the testis which has not come down. It's still in the body. And they are actually at a risk of cancer as well.
Okay.
So this has to be diagnosed at the right age. So the male baby, at the age of 6 months, the doctor is supposed to check whether the testis is correctly in place.
Okay.
If it's not in place, it has to be put in place by a small surgery. If it is ignored, the testis gets permanently damaged, and these individuals are likely to have a zero sperm count later on in life, and nothing can be done. So the challenges which we face mostly as a fertility expert is, we can't make new sperm when there is no sperm being made.
Correct.
We can't make new eggs.
Yeah.
And we can't make an embryo, which is the future baby. We can't force it to stick. So these are the three things which we can't do. What we can do is improve the quality. We can join them together. We can create an atmosphere like a woman's uterus outside the body. Nowadays, they do a lot of genetic tests. Where we are headed is now artificial intelligence. Artificial intelligence is here to standardize everything. Earlier, there used to be a lot of confusion with the reports. Couples roaming around in clinics, they don't know what their reports mean. Somewhere they are told that this is something, and then here they are told this is again something else. Other than that, it helps now to select the best of the best sperm and the best of the best embryo by some technology which human eye cannot match. So it helps, or it's at least trying to help, that you get your pregnancy quicker, sooner, and healthier.
Okay.
And we also do a lot of genetic testing before we keep embryos.
Since you are talking about advancements in the medical field, what do you think IVF is actually doing to all these couples that come to you? Do you think it is actually a good method for people that are not able to get pregnant?
So another important aspect of IVF procedure is the age. So if the age of the couple is a younger age, let us say, particularly the woman, the quality of the egg, the genetic normalcy of the egg, it's the best when a woman is around 25 to 30.
Okay.
That is why we ask them if they are planning to have a pregnancy, may or may not also. But then what if 10 years later they want to try for a pregnancy? You preserve your egg ideally at the age of 25 to 30 years. Age of the egg will remain 25 even though you have become 35 or 40.
Okay.
So that the chance of a healthy and a chromosomally normal and intellectually normal baby remain intact for your future child. A lot of the couples, they have children who are suffering from disorders like schizophrenia, autism, and these are all neurological or psychological disorders that cannot always be detected by blood test. So when a woman is pregnant, they think, okay, doctors will figure it out if something's going wrong with my baby. But they can't figure out intellectual disorders, learning disabilities. And as a result, they are stuck in a lot of stress throughout their life because the child is not reaching the milestones. During school, it's an underperformance. These all are because of a chromosomal issue or a genetic level issue where the brain is not developed the same way as it would have been if it was from a genetically normal embryo.
That's very good.
Yeah.
So you think IVF and IVF ICSI are different things, or is it the same?
IVF started as something called in vitro fertilization in the 1980s. The technology has advanced through the years. There are superfine needles that are used for IVF stimulation injections. In IVF and ICSI, the main difference is in IVF, they just release the sperms around the egg.
Okay.
So the sperm have to still go through one task of entering into the egg. Whereas in ICSI, they take the sperm and inject it right into the egg.
Okay.
So even that last job is also not the sperms. We do it for it.
Okay.
The reason why we do that is the patient goes through a tremendous process of injections and 10 days of ultrasound. So we don't want to take that chance where would the sperm enter the egg or not. Otherwise the eggs would go waste. So that's the advantage of ICSI. It's called intracytoplasmic sperm injection.
Okay, that's new to know. So now just give me like a brief about IVF and IUI and what are the differences?
There's just 3 letters, but the difference is between the sky and the ground.
Okay.
So IUI is essentially a process which resembles your body process. Everything happens within your own body. What's done additionally at the clinic is the doctors and the embryologists, they prepare and wash the sperm. So sperm is a microscopic, it's a tiny structure containing DNA. They are washed and prepared and concentrated such that the healthiest and the most super fast swimmers are placed inside the uterus, and from there it's a shortcut. So normally there is an intercourse, 100 million sperm are released in the vagina. Out of this 100 million, guess how many will go up to the egg?
1.
Yes. So it's not 1. 95% of the sperms, they get killed in the vagina. That's because the pH, it's acidic in the vagina. 5%, that is 5 million sperms, they are in the cervix. From this 5 million sperms, around 100 to 200 sperms reach the fallopian tube. Why this happens? Why there is a filter? Because the woman's body realizes that the sperm it's not a part of my body. It's someone else's. It's a foreign object.
Yeah.
So it tries to attack it using its immune system.
Okay.
Just like how when someone coughs near us, we don't always get that infection. And then that's where the sperm work in waves. Wave number 1. It's like they're waging a war against the woman's immune system, and then few of them, they make it and they wait there.
Achha.
They wait in the fallopian tube for up to 5 days.
Okay.
In that 5 days, if the egg is released, they go and enter into the egg.
Okay.
And that's when the pregnancy happens. Even in a fully fertile couple, it happens in just 20% of cases in the first month.
Okay.
That's important to know. And a lot of people, they try to time the sex with the ovulation. They see it in a lot of movies and television series that on the day of ovulation, we have to be together. The better chances of success are when you preload the sperms into the uterus. So the best way to do it is have intercourse every alternate day, starting around 3 to 4 days before the egg release day. Because the egg, it only lives for 12 hours in the body, whereas the sperm live for up to 5.
So the women really have to track their cycles.
Exactly.
Okay.
And they have that app for that. They have period trackers. They have urine kits where they know that the egg has released.
Correct.
So this helps both fertile couples and those who are actually not trying to get pregnant.
Oh, yeah. Yes, that helps. Do you think the egg count is reducing because of age or even the lifestyle habits? Or is it just the age?
Women are born with around 1 million eggs at birth.
Yeah.
When they are getting their first period, roughly around 12 or 13 years of age, they have around 5 lakh eggs.
Okay.
And then after that, at the age of 20, they have around 1 lakh.
Okay.
Around the age of 35, they're left with 10,000. And after the age of 40, they are left with just 1,000 eggs.
Okay.
And it's not just the number, it's the quality of the DNA inside the egg also. So at age of 25, 90% of the eggs are having a healthy DNA. But at the age of 30, around 80% to 70% are having normal DNA. At the age of 35, it's around 50%. So that means 50% of the eggs are having an abnormal genetic material. Can you imagine how high the risk is going? At 40 years, 80% of the eggs would have an abnormality in them. So it's not just the number of eggs, or it's not just the AMH value that a lot of the people, they are trying to check and think that, okay, we have this many number of eggs. It's not a report card.
Okay.
The quality matters, the DNA matters, and ultimately you want to have a baby who's 9 months old. You don't want a pregnancy positive. You want the pregnancy to go on healthy. You don't want your baby to have any neurological issues.
Okay, so I have read somewhere, it's a quote which says, a man does not age. He's like a horse. What do you think? Is it true?
So in the earlier days, they used to say that a man can produce sperm even till 70, till his death, basically.
Correct. Yeah.
So now the new data, what it suggests that there is something called as andropause. Earlier, it was very popular that women have a
Menopause?
Yes, women have menopause, but now men also have an andropause.
Okay.
It occurs in certain occasions after the age of 40 years, where the quality of the sperm starts to get affected. That is the movement of it and the DNA code inside. There are mutations that are being passed on from each generation. You might have received a mutation from your father's sperm, and you will pass it on to the next person. So this is something called as epigenetics. We have a DNA, and then we have epigenetics, which is an expression of that DNA. That's like the software to the hardware.
Okay.
So every time there are changes in this epigenetics with each passing generation, and maybe you got exposed to some habits or some pollutants, and now you're going to pass on this mutation to your next child.
Okay, thank you, Dr. Shashant. There were great insights that we got today. It was wonderful having a conversation with you. Thank you so much.